Welcome to TMI, a podcast by Henry Ford Allegiance Health. And today we're in the studio with Tim Hernandez. How you doing?
Good.
Good.
How are you, Dave?
I'm feeling good. I'm getting some exercise out there. It's summertime. A lot of the COVID restrictions are lifting, and I'm getting some exercise, getting out, getting excited, and something is coming back this year.
It is. It's been a little bit. Been delayed.
Yeah.
Missed this year. This is actually an odd year for it.
I know. It's cool, though.
So, the Olympics.
Yeah. Olympians.
Yes.
So we actually have an interesting connection here at Henry Ford Allegiance Health with the Olympics.
We do.
And to talk more about that, we brought in some people from our sports medicine program.
Yeah.
To talk about it. If you could introduce them,
I want to
Tim?
introduce our guests we have today. Ryan Rompola, one of our athletic trainers, and Dr. Joseph Medellin are both from our sports medicine practice. They actually helped out with some Olympians who are over in Tokyo. And I'll let them explain kind of what they do a little bit and how they work with some of these folks. So welcome to the show.
Thanks for having us.
Appreciate you guys coming in. And I think you guys were in Detroit for some competition.
Yeah. We were there for Nationals Week for USA Weightlifting, and we saw, a competition for weightlifters anywhere from age 10 to, was it 35 or?
Yeah, I think the oldest was 35 we had. It was 1,000 athletes. Something crazy like 9,000 lifts occurred over the 10 days that we were in Detroit.
Yes. It's a lot of exercise and a lot of weight happening.
Lots of weight.
A lot of weight going overhead, yes.
Absolutely.
So like with weightlifting, I think people have a general idea. We kind of went to school, we did some lifting or whatever, but there's different types. There's people that do bodybuilding, there's, just general weight training, and there's powerlifting, I guess. Can you kind of talk about some of the differences and what you were helping with in Detroit?
Yeah, so Olympic weightlifting is a little bit different than maybe powerlifting, where you're kind of maxing out at one rep, the most weight you can do. Olympic weightlifting is a little bit more dynamic. You have to get the weight over your head, show control, and there's really two different types of lifts, unlike powerlifting where it's like a squat and a bench press. Olympic weightlifting, there's a snatch and a clean and jerk. This is the only two lifts that you do during a competition. And so it's a little bit more dynamic. You have to kind of start in a squat position every time, and like I said, get the weight over your head, show control.
There's a time component to it as well, and then you get 3 chances at each lift. And there's a lot of strategy that goes on too, that I've, covering these events over the years that I've noticed, lifters going back and forth, changing the weight in between their next lifts, kind of trying to strategically place themselves at the top. So there is some strategy involved with it as well. And that's something I definitely appreciate, kind of the cat and mouse back and forth sometimes.
Yeah, because you get so if you get good lifts and bad lifts, and there's referees that judge the lift, and if it's...
This was going to ask, so they actually score you on how steady you were and how...
So they don't necessarily score you on that. What they score you on is if you had control of the weight, if the lift you had was a proper lift, and two of the three judges, have to agree on a good lift or a bad lift, and you get a red light or a white light for a good lift.
Okay.
And if you open too low, then it's going to be hard to get the highest combination of weight to get first place. And so, like Dr. Medellin said, there's a bunch of strategy that goes in, because you don't want to open too low, but also you don't want to open too high and miss your first lift, missed your second, and that kind of forces you on your third for each discipline, for the snatch and the clean and jerk.
Oh, so you get 3 lifts total. So you kind of know, the competitors know how much weight they can do already. They want to make sure they get something good, like in the books, at least as a starter.
Exactly, yeah. And then towards the end of, let's say, the clean and jerks part of the session, they're going to be bouncing back and forth. So lifter A might be at 96 kilos and jump to 98, and lifter B might have been at 96, and then they go to 99 to force lifter A to go quicker in the kind of the cycle. So there is a big cat and mouse and strategy game that most people don't even realize until...
Yeah. And that's where the coaches really come into play with that. So they take care of all of that kind of strategy, so the lifters could just kind of be in the training area to concentrate on their form and focus. And that's kind of where we usually hang out as the medical team. So Ryan's our lead athletic trainer for Team USA or USA Weightlifting, and I'm one of the team physicians. So We kind of hang out as our medical tent, overlooking all of the platforms, the competition platforms, as well as all of the training platforms for the lifters that are upcoming. So we kind of try and get all eyes on all lifters or anyone that could be at risk at any time of getting an injury or a catastrophic injury, and that's the main reason we're at these events. So
how long have you guys been kind of working with Team USA doing these events and being trainers for them?
Yeah, so this is an interesting story because I actually met Ryan in Barcelona, Spain, covering one of these events with the International Weightlifting Federation.
Oh, wow.
That's awesome.
So that was cool. That was about 4 years ago now when I was in fellowship. So when I was doing my sports medicine fellowship, my mentor and program director is the medical director for USA Weightlifting. And so during our fellowship, we covered 2 events, and the first of which was about a month into my fellowship in Barcelona, Spain. And that's where I met Ryan, and he was the athletic trainer. It was a great introduction to the sport at that point in my career, because I did we're kind of explaining. I didn't know all of this stuff about weightlifting back then.
You figured there's more to it. You're just like, but I know how to lift weights.
Yeah. So you pick up things over the years, and you see some pretty gnarly injuries sometimes too. A lot of dislocations, but when you get up there to some of the higher weights, you get concerned of the bar falling on the spine or even on the head or hips. We've seen hip dislocations, cervical spine injuries, and it can be pretty brutal sometimes.
Yeah. So these are like big weights that they're lifting. It's pretty crazy. I couldn't even imagine doing that much weight at once. I'm sure they build up to it, but what do you guys do to help prevent injuries while you're there? Like, what are some of the things that you take into consideration?
Yeah, so preventing injury is a lot usually on the coach and kind of their training sessions they have. We're kind of there not necessarily to pick up the pieces, but if an athlete comes over and is like, hey, my back's really tight, can we take a look at it? The nice thing about our medical teams that we have are kind of an integrated aspect. So we would have a chiropractor, a physical therapist, a massage therapist, an athletic trainer, a physician. So you can really get multidisciplinary care in our little medical areas that aren't usually much bigger than 12 by 12 sometimes. So from that aspect, then we kind of help the athlete make a decision. Is it safe for you to lift depending on what's going on? If it's just a quick stretch or massage that they need, they can definitely get that in our area. So more of the recovery aspect.
Yeah, I would say we're there less for preventative approaches and more for let's get you lifting safely and efficiently, and kind of triage any of the more catastrophic injuries as well. Or some of them will come, like this event in Detroit was 9 days, and so a lifter might lift on Monday and then come see us on Wednesday, like, my shoulder's really bothering me. Can you take a look at it? And so triaging treating injuries after the event too, or after they're done lifting too, because a lot of them stick around and coach other athletes, or they all work together. So it's a great community to work with, and they're all very motivated patients and athletes. So it's nice.
I imagine too, some of the injuries you're helping treat, because some of them are in Tokyo for the Olympics. I mean, so this was before that, so they got to make sure they're good for the next competition, which is
we obviously saw a couple of our Olympians win gold medals at our national championships. Some of them set new U.S. records this week. But also some of the younger athletes that we saw are actually in Guatemala right now, or actually Colombia, at Junior Pan Ams. So there's a wide berth of athletes that we see that always don't make the Olympics, but do move on to some international competitions that are just as important to them as the Olympics are to our Olympians.
Cool. So this event that you guys were at this past week in Detroit, was that like a qualification for the Olympics, or how does that all fit into the scheme of going to the Olympics? And
so qualifying for the Olympics in weightlifting is based off of a point system. and there was a great physicist in the I believe in Sweden that basically came up with this point system. And so you qualify based off of points you win or you're awarded at international competitions and national competitions. So there isn't like the Olympic qualifying that we see for swimming and track on, but they qualify almost sometimes a year in advance, so they'll know they'll be going based off of the point system they have. And so some of our athletes had to get higher points moving forward at our national competition that we were just at. So it's not always qualifying events. It's almost like every event is a qualifying event if you're trying to go to the Olympics, just because you need those points to move on.
And for our athletes going, or they're in Hawaii right now, it's pretty cool. We've been seeing them for the last several years competing at these events, and you could really see the maturation process and, how they've really kind of tweaked their form or kind of pushed their bodies, getting ready for this kind of, this Olympics, the Olympics. So, I mean, it's like the peak of your training is where you want to. This is where you want to peak. This is where you want to do your best. So it's pretty cool to see.
If you know them a year ahead of time, you still want to compete.
Yeah, and you have to give them credit because they've now had to peak twice, right? The Olympics actually should have been last year, right?
Yes.
Thanks, COVID. But so they've had to peak again for the second time in a year. And we're talking some of these athletes, if you're lucky, you go to the Olympics once, maybe twice.
Yeah.
Not everyone's Michael Phelps, but to do that twice is just compliments to all of the Olympic athletes this year to be able to do that again for the second time in a short amount of time.
Yeah, that's crazy. Like that can take a lot out of you. How have you guys seen some of these athletes like mentally prepare for this after going through all that and just like, because you were saying it's not like one qualifying, it's like it all builds up.
Yeah.
Yeah, I mean, we sat down with a couple of the Olympians when we were at this event and got to communicate with them a little bit. They seemed just very easygoing and relaxed and like ready to go, and like they seemed like they were very focused. I don't know that we did anything to really help their mental state of mind, rather than maybe providing some reassurance and triaging some of the things going on with them, but. I say they seemed focused, motivated, and enthusiastic and ready to go. Some of the cool things they're doing in Japan, or not in Japan, in Hawaii though, because they're all there right now, is like they're on different like sleep schedules, getting ready for Tokyo. Like
that makes sense.
We're really trying to, we're really trying to
science.
optimize the science of getting them ready for travel. And during COVID, like we have all these restrictions for them too, to keep everyone safe. So, where historically, I guess the Olympics, you would go and you'd stay there for a while and finish your training off there at the site. We aren't really doing that this year. So it's another aspect of things that takes it to a whole different level. So
that's true. Usually, they have their Olympic village where all the athletes stay, a couple weeks, prior to, and then all during the Olympics is where they're at getting ready, like you mentioned.
So yeah, they're basically in a bubble right now in Hawaii and doing their training and getting on, Japan time basically. And it's pretty cool.
So with Olympians, do you help with, I imagine both men and women competing, right?
Yes.
So how does that work with like, in my head too, I'm thinking, is it just whoever can lift the most, or is there weight classes? Because there's going to be bigger and smaller people in general, and
absolutely,
age-wise too.
Good question.
There is 8 weight classes. Everything in Olympic weightlifting is in kilos. So 2.2 times 2.2 in
pounds.
American pounds or imperial pounds, imperial weight. So there's 8 weight classes, and so divided off that by your body weight, you will be based in your class. And I think in 2012, the winner of like the 96 kilo men's class lifted 2.5 his own body weight.
Wow.
So if he's a couple hundred pounds, he's lifting what is that, 500 pounds?
Yeah.
Close to
500 pounds over his head and showing control of it.
Yeah. He is very technically sound.
And he's doing it 6 times at the Olympics, right? Because you have 3 snatches and 3 clean and jerks. Obviously different weight at each one, but I do 3 bench presses and reps of a bench press. I'm like, okay, that's enough. And I can't imagine trying to do that 500 pounds over your head and have that confidence for it as well.
Well, you mentioned too some of the strategy. So if they're setting records, they have to kind of plan that last lift to be a record, right? Is that my understanding? Am I
Ideally,
that right?
yeah. Or they just come out and so they'll do their first lift, make sure it's a good one, get it in the books and get it recorded. And then they'll come out, maybe try to break that record. And if they do, great. They might add a kilo because you have an automatic kilo increase every attempt you have after a good lift. And so their next lift they might break their own record within 2 minutes of setting it, which is kind of cool if you think about it.
Yeah.
And that, I mean, you could medal in, so that brings me to the other, like the scoring part. So medaling, you could get a medal in just your the snatch, so one event, or you get a medal in the clean and jerk, or they add those 2 weights together and then you get like a final cumulative overall
Gotcha.
like the weight of both of those together, and that's how you can medal too. So if you're the top person at all 3 for all 3 weights, then you end up with 3 golds basically.
Very cool. So I have to ask, I'm assuming I kind of know the answer. You guys aren't going to be in Tokyo, are you?
No,
We are not.
no. Yeah, part of our team is going, but part of the team that we work with, which is great.
And obviously very limited numbers with all the restrictions and making sure everyone's safe and the preemptive measures that they have. So even volunteer-wise, I was talking to somebody and they're going to be significantly down on volunteers just because of what's going on over there. So be excited to see it though.
Jumping back a little bit. So you guys said you've seen some kind of gnarly injuries. Obviously we don't want to see injuries. That's not, we want them to stay.
We would like to be bored.
And
the whole
compete.
We would like
Yes,
to
it's
be bored
good
and
to be
just watch
bored.
and enjoy the competition, but we're there in case.
Like what
something
kind of
happens.
things do you see, or what have you seen kind of helping at some of these competitions?
We've seen simple, and I say simple thumb dislocations, elbow dislocations,
Okay.
torn bicep muscles,
torn quad tendons.
So a lot of tears, a lot of dislocations. Olympic weightlifting is very dynamic, and it makes it very hard on your body. And you kind of put joints to kind of maximum range of motion.
I imagine probably maximum stress with the weight too, how much they can actually handle.
Exactly. Yeah. And in some of these big competitions like the Olympics, you're going to lift every kilo humanly possible for yourself to try to be the best you can on kind of the world stage. It's kind of the pinnacle of Olympic weightlifting is the Olympics.
Yeah. It's awesome. I mean, I feel bad for people that hurt themselves.
Yeah, obviously, yeah, we don't want that to happen.
But we know it's cool that you guys get to, and the people that will be there in Tokyo. I mean, you've worked with them. Some of those people competing, right?
Yeah, absolutely.
We do. Yeah.
And one of them is 20 years old, and he's got a pretty good chance. CJ Cummings has a pretty good chance of medaling. Which is crazy because at 20, I can definitely tell you that I was not an Olympian.
He is athletic and built.
So
Yeah.
And Maddie Rogers is another big name. She's an amazing athlete as well, and a big inspiration to females in the sport too. I would say so. There's that component to it.
And the awesome thing about Olympic weightlifting is that some Olympic weightlifters kind of just pick it up randomly because they like to lift weights and they were a CrossFitter, and then they found Olympic weightlifting, and you can really excel at the sport if you are very disciplined and you are very technically sound.
Yeah, and to that point, I guess some of the silver linings of COVID that I heard throughout the week in Detroit was some of these high school students that were competing. They found weightlifting from not being able to do their like track and field or shot put or things because COVID was shut down. And then, I was talking to one father of one of the athletes, and she was she's getting recruited heavily for track and field Division I to be a thrower, and she's like, I love weightlifting now. I want to do that in college instead. And she's like, I just, COVID kind of shut down track and in my state. And so now I like this. So
And she's just kind of
picked it up, and she's already,
competition.
it's less than, a year later, and she's competing at a national level for her sport. And I think it's those little stories that I heard throughout the week that are very encouraging that, for the sport as well. So,
Yeah, because everyone knows someone that has weights in their gym or in their basement and kind of, that's what we're going to do now.
And I always think of the ultimate, like, but when you keep saying, I hear you say technical, I always think of like, is it the world's strongest man or whatever? You see these giant, huge guys like lifting cars or big boulders, but I'm like, that when you say technical, I'm like, they're probably not technical at all. They're just lifting as much as they possibly can.
Exactly. When I say technical, I mean when you're going from a squat to bringing the weight up by your throat, how quickly you're able to do that, and how quickly you're able to get your hips behind it.
And you watch some of those, I think in my head, like I've seen some of those strongest men competition things, and some of those guys can barely walk.
That's more the powerlifting side of things.
Yeah. So, you know what I mean? That's it's just interesting because there is a lot more, like I said, physicality to it, a lot more motion to it that has to be mastered. I guess.
And it's like any sport, a lot of nuances and technique.
That's awesome. So, and I'm assuming you guys you've been helping for several years now. You're going to continue into the future with the Olympic.
Yeah, definitely. So this was actually a nice event because it was close to home. So we were in Detroit, and usually, like I said, we're going to Barcelona or Ryan's,
Rovenheim, Finland.
Imagine traveling's not
Vegas,
bad either.
Things like that, where we travel around the nation and internationally for these events. But being in Detroit was such a good luxury because we had Henry Ford, Maine that was close by too. And for some of those injuries, we were able to coordinate care with some of our partners in Detroit, and it was just very streamlined, and I think people really liked that as far as the athletes that needed care.
Yeah, it showed the strength of the Henry Ford system from here in Jackson all the way to Detroit, and how seamless that transition of care can be throughout our system.
Awesome.
Great. Well, Tim, I think we've learned a lot here today.
Yeah.
And I think I now know why you invited me to help you move next week.
Might have a few heavy couches.
Ryan's
get me into
available.
this lifting thing, the idea in my head, so I can help you.
We just have a different build and body.
Yeah.
I need somebody to help with the couches.
Okay.
Yes.
Okay.
You guys would be perfect Olympic weightlifters.
Yeah.
Awesome.
I wouldn't
Cool.
say that.
It's worth a try.
We'll be lifting couches and
This might get us started.
other household items. I
don't think you need to lift the couch overhead though.
Yeah.
Just a
that's
tip.
true.
Maybe a refrigerator. You don't have to move a refrigerator, do you?
No.
Oh, thank
We're off the
goodness.
hook on that one.
There you go.
Okay.
Recommend a dolly.
Yes, we have a dolly. Yes, I am not an Olympic weightlifter. I use dollies.
Okay.
I use other
Okay.
apparatus to help me carry things.
Good.
So, but thank you guys. I appreciate it.
Yeah, thanks for having
coming
us.
on our show and talking with us about the Olympic weightlifting and the helping some of those athletes through our sports medicine program and some of the athletes in Tokyo competing, which is really cool. I think.
Yeah, we're excited.
Wonderful. Yep. And if our listeners out there, if you want to hear more of these podcasts, you can check them out on iTunes. It's on our Facebook page, on YouTube, pretty much everywhere where you can get content, you can find the TMI podcast. So thanks everybody for joining, and we'll be back soon.
Thank you.
Thank you.